Hi, my name's Kirsty McLeod. I'm a physical care outreach nurse at the Kirsty Hospital. Um, this is my poster to display my experience of the ARC internship. So why did I apply? So this takes me back to the beginning of my research journey. I wanted to explore how I could integrate research into my role. So back in 2010, I undertook the Clin MRes, completed in 2012. Then had an interlude in clinical and academic career progression to raise a family. And then when sleep finally returned to my life, I started to look for other research opportunities, which led me to a successful application in a CPCR secondment, which is Kirsty Patient-Centred Research. I had the opportunity to look at a clinical research question with backfill time and support from the CPCR team. This is where I discovered DIVA, difficult intravenous access, where a patient experiences multiple failed attempts at cannulation because they have difficult to access veins. The critical care outreach team, who I work with, over time have become the out of hours expert cannulators. So patients who are difficult to cannulate would get escalated to us after many failed cannulation attempts. It was distressing for patients, and it was distressing for us to have to attempt further cannulation after what they'd experienced. So I started to ask, what can we do to improve the patient's experience? This led to a pre-doctoral application, unfortunately unsuccessful in 2021. But my research plan was not fully formed and I needed more experience. So I applied for the ARC GM internship, which I was successful with in 2021. And this was to develop my research plan and to gain more expertise to evaluate the evidence in this topic area. I also wanted it to answer the question, do I still like research as much as I did in 2010, some years on, and do I still want to integrate it into my role? So I went into the internship to develop the research plan, and to do this I needed to understand the evidence base on DIVA in further depth. So I joined the ARC evaluation theme. I did the master's modules, so in critical appraisal and evidence synthesis, and the Cochrane modules as well, all while learning from the experts, Jill Norman and Chun Hu Shi, our academic supervisors for the evaluation theme, who were extremely helpful and supporting our learning throughout the formal learning modules, but also some informal learning within our group, which was absolutely invaluable. Things like risk of bias assessment practice, meta-analysis and grade explained in greater depth, and some confusing statistics explained, which at the time I did understand and probably have since forgotten. But all this was really useful and essential for preparing my pre-doctoral fellowship application. There was some more targeted learning around PPIE and attended some webinars and which helped with my plan for the application. Also searching the evidence webinar and JBI scoping review webinar, which was also really useful for my application as I plan to do a scoping review in the pre-doctoral year. I also used the time to learn how to use a reference manager, which was definitely a bit of a light bulb moment for me. I have been using a Word document until this time, and I will never go back now I've learned how to use that. So that was great. So during the latter part of my internship, I started to prepare the scoping review protocol with support from Jill and Chun Hu, and I also had support with the pre-doctoral fellowship application. And once I'd had been given an interview, they were kind enough to give me some much needed interview practice. So successes, what did I get? What did I get out of this? Well, a successful pre-doctoral application, as I am doing on the pre-doctoral fellowship year now. Also, loads of research experience, really invaluable and increase my critical thinking and confidence in the research area. Setting up in clinical practice, I've set up and leading a DIVA task and finish group where we are looking at improving the patient experience based on the current evidence available. And most importantly, I think it answered the question for me. I do still like research, and I do want to pursue a clinical academic career pathway. So that was great. So what next? My scoping review protocol has changed into a systematic review protocol, which has been an interesting process. But this is to explore and evaluate the quality of guidelines on the identification and management of patients with or at risk of difficult venous access, and synthesise these recommendations. And then I'd like to compare the review findings with local practice to identify the gap between evidence base and practice, and this will include looking at local protocols, SOPs, standards for DIVA in various hospitals. This should lead nicely on to a scoping review, which will look to identify the barriers and facilitators to optimal management of patients with difficult venous access. And I'm going to do some PPIE, so some staff interviews or maybe a survey around barriers and facilitators to optimal cannulation of DIVA patients, and some targeted focus groups with DIVA patients themselves to gain any further insights into their experience, but also to ensure that the work is relevant to the patients and their experience. I'd like to publish the systematic review and the scoping review and the gap analysis, and hopefully by the end of the year I will be working towards a PhD application. Yeah, so that's it. Thank you.